I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for following our YouTube channel. And you know that most of my videos are cosmetic facial surgery, specifically face and neck lift surgery. One of the questions we get a lot is, what am I going to look like right after my facelift? Because the word facelift in and of itself is scary. 40 years ago, that was 4 to 5 days in the hospital with incisions all across the head and crazy stuff, and it's gotten much easier. So essentially, your recovery is based on the number of procedures that you do. If we're doing just a face and neck lift, we have incisions in the sideburn, in front of the ear, behind the ear, and under the chin. If that's all you're doing, that's a pretty straightforward recovery, and people don't get really very bruised or very swollen. Now, most people are doing multiple procedures. So some people may do a lot of procedures at the same time. They may do their facelift with a brow lift and upper lids and lower lids and cheek implants and chin implants and full face laser. And so the more procedures you do, the more comprehensive your recovery is going to be. And it's important for people to understand and not be afraid. So what I've done, I'm very lucky that I have a group of patients that appreciate education. They've allowed me to use some videos, and I'm going to show you these patients 24 hours, 48 hours, 1 week, 2 weeks, 6 weeks after their facelift and interview them on their experience. One of the things that's very rewarding for me is I see so many patients from out of town and even out of the country. The downside of that is I don't get to follow them because they stay here for a week or so and go home. But these are patients that are local, and we'll take a look at them and share their experiences. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and if you follow us on YouTube, and I hope you do, so you better subscribe, you know that facelift surgery, face and neck lift, is my favorite operation, and we're so lucky to have such great patients. And I get the question very frequently, what's the recovery like after facelift? What do you look and feel like the next day? Well, I think that this is a terrific example. On a lot of patients, we'll do 4 or 5 procedures: eyelids, brow lift, facelift, laser, cheek implants, chin implants. But when we do just a facelift, which we commonly do, it really is a pretty straightforward recovery. So here we are, 24 hours out. So tell us a little bit about when you woke up and your recovery and last night.
Sure. My recovery was good here at the office. I was in the recovery room and came out of anesthesia. My caregiver took me home, and I was propped up in bed. I had a travel pillow around my neck, and I basically dozed all night, having water, of course, and I had a couple of protein shakes to keep me nourished. And then I was taken here to the office, and I'm in front of the camera now, doctor.
Did you have much discomfort?
No, I didn't. I'm actually just taking Tylenol, and I'm taking my prescribed medicines for infection and such.
All right. So when people come in the next morning, we'll take some peroxide and clean up their incisions, and everything works, which it always does. She has all her normal function. So here's our incisions, 24 hours. You can see that everything's hidden in the hairline. The only stitches that you can see are right here. We use only dissolvable stitches, so they don't need to come out, because we do a lot of out-of-town patients. We have a drain in, which we'll leave in overnight, and we'll show you the other side. Once again, it's very important to hide any of your incisions in the hairline and not to change the hairline, so the patient's able to wear their hair up, and all these stitches will dissolve. Nice tight neck, a little bit of bruising. You can see the drain here, but this is how they're supposed to look. This is a perfect 24-hour facelift patient. I'm Dr. Joe Niamtu, LoveThatFace.com. Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and we're back. So if you remember, we looked at this patient 24 hours after her surgery, and now today is 2 weeks. And this is the time that most people would go back to work, and we'll show you some close-ups of her incisions. But how you doing? Tell me about it.
I'm doing really well. The 2 weeks have been a wonderful stopgap in my recovery. It really makes such a difference after the first week, so I'm quite pleased.
And she's healing really great. Everything looks well. Her swelling's down, and she could easily put makeup on and cover her ears and go back to work. So we'll show you her situations here in a second. So here we are. We're going to look at our incision, and you can see, obviously, you can still see the incision. However, that's healing very well for 2 weeks. two very important things here. Number one, her sideburn is totally natural, and the incision line is in her hair. So that hair is going to camouflage that, so you're never going to see it. Some people make the incision down here, and that's quite visible. Also, her posterior hairline here is going to be unchanged, and she'll be able to wear her hair up. You can see the stitches, again, are pretty much hidden in the hairline, and these stitches behind the ear are going to dissolve. And you know, she's just done great, and this is exactly what we want to see, and I'm so happy that we're so lucky to have such great patients. I'm Dr. Joe Niamtu, LoveThatFace.com. And here are the sutures under the chin here where we did the neck, and that's healing well. Her neck is nice and smooth, just tiny little bit of bruising, but this is what we want to see, and this is just healing great. So we're talking to some patients 24 hours after surgery. Now, when you have cosmetic facial surgery, obviously you're going to have recovery, you're going to have swelling, you will have some tightness, you will have some discomfort. When you do a facelift and a laser, which we do a lot of, it really looks bad at first. However, it's not as bad as it looks, so tell us a little bit about that. Speak up too so we can hear you.
Okay, my night was very good. It just feels very tight, but I did really well. I didn't have to have much pain medicine at all. There's not a whole lot of burning with this one. So I feel like I'm doing really well since the surgery. Mm-hmm. And I know it's going to get worse to get better, but it wasn't as bad as I thought it was going to be the first night.
Thank you. And that's a pretty common theme. And again, the laser, you know, when we do a facelift, that's like doing body work on a car. All right. And when we do a laser, that's like painting the car. And, you know, it's a little bit more recovery. And I think it looks scary. But as you can see, it's not that bad. And we'll check in with her in a week or a couple weeks. And she's going to be smiling and happy because she's going to look really good. I'm Dr. So in our series, we're looking at patients after their facelift and other procedures. So here's my buddy. We talked to her 24 hours after her facelift. And so here we are 14 days later, 2 weeks, and we did a comprehensive facelift with smastectomy and platysmoplasty, full face, relatively aggressive CO2 laser, and a light laser on the neck. So tell me about your last 2 weeks.
The last 2 weeks have been exactly what I expected. Everything was put out before me as to what to expect. I read the information, I followed it precisely, and I've had no difficulties, no problems, and really had not very much pain at all. So all in all, it's been exactly what was told it was to be expected.
Very good. And now at this point, she can start some lighter activity, maybe walk on a treadmill, that sort of thing. And this is really, I mean, I think a perfect recovery. The laser adds another layer of recovery to it, so that's just another little hassle factor. But she's doing really well. She's a great patient. We'll come up and show you her incisions in a second. So we have a natural but swollen earlobe, a little swollen there, and that'll go down. And this, you just won't even be able to see this in another couple weeks. And then the sideburn incision's way up here. So we have not elevated her sideburn. So if you look at a patient and you look at their sideburn, their earlobe position, and their back hairline, which is normal here, that's what you want to look at in, turn that way a little bit. That's what you want to look at for a natural facelift. So she's going to be a great case, and she's a great patient. So at 1 week, you can still see, I only use dissolvable stitches, so there's no stitches to take out, but you can see that her incision is hidden in her hairline up here. You can't even see that. This incision will just heal wonderfully. Her earlobe is very nicely positioned, and all the incisions behind the ear are hidden in her hairline. With another one of our great patients 2 weeks after his facelift surgery, and so tell us a little bit about it.
Well, I had excess scan on my neck that I really wasn't happy with. So I came to Dr. Niamtu to see what could be done. Agreed to have the procedure. It was a neck and lower facelift. It really went smoothly. The first night, there was a little bit of discomfort, but after the first night, I really couldn't say that I've been bothered by the procedure at all. This is really the only second week after the procedure, and I'm feeling good, and the stitches are out, and I think the result is fantastic.
Well, tell you what, great results are easy on great patients, and you've been great. Thank you so much. So you can see at 2 weeks his incisions are healing great. I think in another week or two you're not going to be able to see him at all. And we pay very careful attention to not moving the sideburn. So you see his sideburn is natural, and so is his hairline behind his ear. So that's so important to have a continuous hairline, natural sideburn, natural earlobe, hidden incisions. These are truly the art of facelift surgery. So same thing here. You can see obviously at 2 weeks you're going to see the incision, but it's blending nice. Natural sideburn, natural hairline, natural earlobe. And this is what I do, and I am very precision oriented, and I am so happy to have such great patients, and this is going to be a fantastic result. I'm Dr. Joe Niamtu, LoveThatFace.com. So looking at the incisions behind the ear, you can see how well these are healed, a little bit of scabs. And if we actually pull the hair, you can see the incisions hidden in the hairline, but if we pull the hair away, that's just really nice healing, and I'm proud to have done a good job on such a great patient. So here we are in our continuing series. Now, we talked to my friend here 24 hours, I believe it was, after his facelift, so he was pretty beat up. And we've had 6 weeks now that have passed, and how time flies.
Yes.
So you look great. You're getting there. You're not totally healed, but you certainly are very presentable. How's that 6 weeks been?
Well, it's been pretty easy. After the first couple of days, the comfort level was not bad at all, and the swelling that was there after the surgery disappeared pretty quickly. There's just some residual numbness at this point, and I'm very happy with the outcome.
Well, it's looking real good. We're going to look at the incisions in a second. And, you know, one of the things that scares people is they don't know what to expect after facelift. So this video series is really to show people that, you know, here's what you look like at 1 week, at 2 weeks, and now at 6 weeks. We don't really take our final pictures until 12 weeks. And so he's about halfway there. He still has a little bit of firmness and swelling and a little bit of numbness, but looks good. I'm proud of you, man. It's my honor to be your doctor. And this is what's fun about my job is watching people get their confidence and look younger, and look younger than their doctor, unfortunately. All right? Okay, so we're going to look at the incisions, and you can see where we came around here. Over the next 6 weeks, that'll be imperceptible. You can hardly see it right now, and his sideburn incision is up here, so that's covered by his hair. And this is the only incision you see in the back right here, because everything else is in the hairline. And behind the ear, that incision is healing very well. So he's just right on track, and I think it's going to be a perfect case. Lucky to have such great patients. I'm Dr. Joe Niamtu, LoveThatFace.com. Less than 24 hours after our facelift, and we have the drain in, which we'll leave in for a day or two. And how are we feeling, darling?
I am great. It's been a great experience. I thought I was going to have a lot of pain yesterday, but it was absolutely wonderful. The only thing I took was 1 Percocet, and the rest of the time I took 650 ml of extra strength Tylenol. It's been wonderful.
And you know, healing is variable. So this is an A+. I mean, this is like she didn't have anything done, and we did a comprehensive facelift. Other people, you know, it takes a little bit more of the wind out of their sails, but usually in the right hands, the right surgeon, the right anesthesia, and the right patient, it works out really well. So of course we have some lumps and bumps and puckers and swelling and bruising, which you would expect less than 24 hours after facelift. But I think you've knocked it out of the park in terms of recovery, and I think it's just going to get easier. Anything else to say?
Dr. Joe Niamtu is the best. That's all I can say. He is absolutely the best.
Again, great patients make everything in the world. I'm Dr. Joe Niamtu, LoveThatFace.com. Hi, in our continuing series, here we are 24 hours after facelift, some laser to the under eye and to the festoons, and removal of a bunch of little moles or DPNs. So we have a drain in, and that's what you can see on the neck. So I see you're drinking a cup of coffee. You must feel pretty good. First day out of surgery. Tell us about last night.
Well, last night I did rather well. I was up most of the night, urinating because I was doing protein shakes all last night. But other than that, I did a whole lot better than what I thought I would do. I was not in pain very much at all. As a matter of fact, I've taken very little pain medication. I only took one just before I came here. And so, and I look a whole lot better than what I thought I would look. And so I guess that's a testament to your expertise in this field.
Well, you had something to do with it as well. Picking the right patients is important. But so many people fear what they're going to look like or feel like. So the more procedures you do, the more swelling and bruising you're going to get. If we did a full face laser, obviously if you've seen in other videos, those people look a lot worse. They don't necessarily feel worse, but they look worse. So this is a facelift, a little bit of laser, smile for everybody. All right, you're a great patient, and we'll check in on him later. I'm Dr. Joe Niamtu, LoveThatFace.com. Okay, so if you remember, we were here with my buddy at 24 hours, and now we're at 6 days, almost 1 week. So how's it been?
I'm doing a whole lot better than what I thought I would be doing. I mean, I've recovered fairly quickly. I'm doing, everything I want to do. I'm just being careful, not doing anything strenuous. But I'm doing pretty well. No pain at all.
You look great. You really do. You can see his laser has peeled off, and obviously most guys don't shave. And we'll come up here in a second and look at his incisions. So again, hidden in the hairline, in front of the ear, incision behind the ear, incision in the hairline. So most of your incision, about 90% of it, is hidden. So he's doing really good, and great patient, going to be a great result. So here we are. Remember, our sideburn is incision is hidden in the hairline, so you're not going to see that. That's healing. And this incision is also healed back in the hairline, so you're only going to see just a very small amount of incision, and the rest is hidden behind the ear. So here we are, 24 hours after Vic's surgery. She had a comprehensive facelift with platysmoplasty, had upper eyelids, lower eyelids, and lower eyelid CO2 laser resurfacing. So had a lot done. How do you feel?
I feel great, actually. I realize a little puffy, but I feel physically. Can't run a marathon, but I feel very good.
Good. Were you have a lot of pain last night, or?
Not too much. This morning a little more stiff around my neck, but
Okay.
take a Percocet
All right.
every few hours.
Are you excited?
What? Yes, yes, very.
Your profile already looks great.
Oh.
There's no extra skin here. I think we had took 30 years of aging off there. You do have some black and blue, and of course you have the laser and some swelling on the upper lids. So we'll come over here and look at things close up in a second. So again, 24 hours later, you can see our sideburn incision will be hidden by the hair. So there's hair under it, there's hair above it, and we did not move her sideburn. This is her anterior incision. Behind her ear, there's an incision that goes back into the hairline. So you will not see any of these incisions. They're just going to heal great, and that is really the surgeon's signature. So we've done 1,000 facelifts now, and I am really excited. I love coming to work. I love doing facelift surgery. I think it is has the most impact of any cosmetic surgery procedure. You can hide mediocre boobs and bellies and butts, but a facelift is out there for everybody to see, and it's my specialty, it's my life's work, and I love doing it, and what makes it best is having patients like this. I'm Dr. Joe Niamtu. Love that face.